That, I hope, gives you an idea of what we're doing as far as basic research is concerned and preclinical development. I would now like to introduce my co-MC, Mitesh Shah. Dr. Shah is a professor of neurological surgery and the Paul B. Nelson Endowed Chair. He is also currently chair of the Department of Neurological Surgery at the Indiana School of Medicine. He is one of three co-directors of the Neuroscience Institute, who is co-sponsoring this symposium. So please, Dr. Shah.
So thank you, Bonnie. I think I'm holding this high enough. Sorry. We need to do.
Is it better?
Okay. All right, I think that's close enough. Well, it's really a pleasure for me to be here, and just to show you what it takes for collaboration to occur. A single email from Bonnie announcing that she had received this grant led to so many things in such a short time period. The development of this symposium was one of them, but I think I invited you to listen to one of our Carlsbad professor lectureships, which was John Kessel, who leads the hydrocephalus research network. And that presentation and you being there allowed you to see how many other people in our clinical department were actually interested in hydrocephalus work. And now we have one of our residents working with you in the porcine model. And then just recently, I shared with you an email from a potential candidate who's looking at a pediatric neurosurgery section chief position who's doing work in hydrocephalus. So, and his wife is part of the Hydrocephalus Association. So what a small world we live in today. So let's see. I'm going to begin. Thank you for the nice introduction, to tell you that I wouldn't be a neurosurgeon had it not been for hydrocephalus research. So my career started, I would say, in neurosurgery in between my freshman and sophomore years in medical school, where I decided to work in Pat McAllister's lab for a summer project. And I actually made newborn rats hydrocephalic using a Kalin model. I thought I'd never, ever talk about this project before in my life again. And I thought it would be interesting for you to see the journey that your life could take. Many of you are students out here that you never know what's going to come back to be utilized in your career in the future. So I actually had the honor of publishing this paper with Pat, and his mentor was Ray Truex, who was a pediatric neurosurgeon. And it was the collaboration between the clinical work and the basic science research that got me interested in neurosurgery. We actually won third prize at a University of Miami symposium, and that led me to develop my interest in my career here. So many of you have heard about the new academic health center, which is really what's exciting to me. It's not about the buildings. It's really about the health district, the creation of a 44-acre facility that will have green space in conjunction with all the brand new buildings. Some of you may or may not know this. This project is the largest healthcare project in all of North America currently, and it may be in all of the world. Brian Nagy, the president of the HC, is trying to figure this out. The hospital complex is going to be spectacular. It's a 16 unit tower that have 3 towers actually. There'll be 50 brand new state-of-the-art operating rooms, 380 new clinic exams. Do I have this? Yeah, I want to show you this. So the main hub of neuroscience work will be in Goodman Hall, which is the Neuroscience Center that includes both the research center as well as the clinical piece, which is on the right, the left-hand side here. And then the development of the new IU School of Medicine Medical Education and Research Building. I believe this is the first time in the school's history that the project of this scope will be put in Indianapolis in 50 years. So it's a long term, or it's a long time in coming, actually. But what's very unique about this is that the adjacencies of the people who are interested in both the neuroscience space and the clinical world of neuroscience will be right next to each other. But you folks are just 5 minutes away, actually, it turns out, which is fantastic. And this is a beautiful facility. So I'm looking forward to more collaboration. More than the buildings, it's about the programs that we can develop. And today is a great example of this. So the School of Medicine and the healthcare system has decided to invest their funds into 3 major institutes: the cancer, the neuroscience, and the cardiovascular institutes. So what this means is that we're going to transcend the old typical models of doing projects and programs inside of departments or service lines. For some of you, you might not know what a service line is, but that's things inside the hospital, like the spine service or the orthopedic service or the neurosurgery service. What they're concerned more is with clinical output and clinical parameters. They're not as much interested in what the school and the healthcare calls the tripartite mission of patient care, research, and education. So this is something that the institutes allow us to break down sort of the walls and then not create silos that we've had in the past. The Neuroscience Institute has 6 centers that we are going to focus in on. So those are the Neurodegenerative Disorder Center, spinal disorders, neurovascular, the Center for Neurotrauma, and neuromuscular disorders. And the most recent center we've added is the Center for Neuro-Oncology, which will be a joint venture with our cancer center. I'm happy to report that we have at least 3 center directors that have started. Donna Wilcock will be the leader for our Neurodegenerative Disorder Center. The Spinal Disorder Center is led by David Stockwell, and the Neurovascular Disorder Center will be led by Rick Shear. We're looking for center directors for neurotrauma and neuromuscular disorders. We have named a neuro-oncology center director who will start in the first quarter of 2024. Aside from the centers that we're trying to develop, the healthcare system wants us to create destination programs or centers. And so what this means is these are areas of expertise because of various things like our personnel, our infrastructure, equipment, that allows us to make programs that bring people from all across the state and, for that matter, all across the country. So for example, this year we were fortunate in that we were able to consummate our first destination center in skull-based surgery. We're working on things like a pediatric brain tumor center, brain med center, and it would be our goal to eventually even do research centers like the Hydrocephalus Research Center inside the Institute. We were very clear that we wanted to make sure that dollars were being spent properly. So we asked for what are the measures of success so that both the school and the healthcare system was clear on sort of the mission. And so here are the goals: the clinical growth. Patient care is the single most important thing about the Institute, so having market share. But more importantly, to the School of Medicine, it was about NIH funding, US News World Report rankings, the importance of having high impact clinical trials, as well as making sure our quality and safety metrics were being met. And most importantly, to also make sure that the education mission of the school was not being lost by developing programs. So this is my team of 13 adult neurosurgeons that cover the academic health center. We have 4 pediatric neurosurgeons. Many of them actually have interest in hydrocephalus. Jesse Savage, for example, he's the site PI for our PENS trial, which you may be hearing about. That is the trial to look at the role of shunting in NPH patients. We have Rabia Kaiser, who's actually looking at models for understanding what happens to shunt catheters and why they fail by looking at the cellular pathology around the shunt catheters. And then Jignesh Taylor, whom you'll meet later, I'll talk more about what he's actually working on in his introduction. This is our basic science team. We currently have 5 basic science faculty members, and we're starting to grow more of them. And we have 3 surgeon scientists currently. So Doctors Dang, Liu, and Wu and Gao are predominantly working in our spinal cord and traumatic brain injury lab. Nuruddin Manti is working on neuro-oncology projects along with Angela Richardson and Jignesh Taylor. Matthew Pease is our most recent hire, and his main focus is data science and using AI and machine learning to in the realm of predictive medicine. So to achieve the goals of the centers, we also believe that certain cores have to be developed. So we have a very strong core in things like neuroimaging, genetics, biomarkers, and therapeutics and interventional core. We're developing stronger cores in bioinformatics and healthcare information core. And then with our co-director's interest, there's going to be a strong clinical trial methodologies core, along with the neuroscience outcomes research core. So one of our goals is to really talk about what are the entities that are present inside the healthcare system and the school that allow us to operationalize these cores. So some of these entities include the Indiana Clinical and Translational Science Institute. This is a statewide research partnership between IU, Purdue, and Notre Dame. And the key elements of support include things like service cores in bioinformatics, genomic and proteomic analysis, and our biobank. We have over 1,000 brain tumor specimens in our biobanks that is run by the CTSI group. CTSI also works on community health partnerships, global health programs. Our team actually recently went to Kenya on a camp for neurosurgery, biostats, epidemiology, and research design. And they also run career development, education, and research training. And then we have another entity called the Office of Clinical Research, which is a joint venture between the school, the university, and the healthcare system. And this helps investigators with contract negotiations, clinical research training, and support and analysis of research billing. The final entity that I want to talk about is the Enterprise Clinical Research Operations facility. It specializes in supporting our research in complex clinical trials. So this particular entity has a high RN to coordinated ratio so that they actually provide 24/7 call cover services. So for complex clinical trials that, like spinal cord injury patients that come in all hours of the night, this particular entity helps us run this. But really to ensure that IU is a future leader in high-tech clinical intervention and research, what we've decided to do is really to develop these innovations in neuroscience core more. And this is something that I have a lot of passion about. And so the way we are going to try to create this core and develop it is through 4 pillars. So what are those? Developing a surgical skills lab, a simulation lab, and a center that will house our AI, augmented and virtual reality center, our 3D printing lab, and then a translational research facility that will be a virtual center that will allow us to actually take all of the resources that are available across the state and collaborate in a way that we can actually, through the institute model, be able to bring projects in and increase the scope of the projects because of our relationships with things like Purdue University and the Engineering School, 16 Tech Innovation Center, which houses the IBRI, and the Indiana Center for Biomedical Innovation that are helpful in drug development, and then also things that we talked about at the Indiana CTSI. So we visited very many sites across the country to sort of model our surgical skills lab. This will allow us to train residents so they can do things like, Dr. Mitchell helping you with the animal models. The other thing that I'm very excited about is bringing in very new technologies. I call this the future lab. augmented reality, virtual reality, robotics. We have 3 robots currently in neurosurgery that we're using, and we already have some projects for 3D printing to help not only the education piece, but resident learning about anatomy, which is much cheaper than using cadavers. So we're really excited about what's going on in the Institute, and we really share our enthusiasm to develop more collaboration with things at the Basic Science School. So thank you for allowing me to present this.
Lauren couldn't join us today. Okay,